Hello, everybody. Thank you so much for joining us once again for the Shangsheng School of Tibetan Medicine webinar series. Here from our baseline of traditional Tibetan medicine studies, we discuss topics of health and wellness, exploring tools from Eastern and Western traditions, from ancient spiritual philosophies and healing sciences, along with modern research and current issues in global public health. We would love to connect with you and collaborate, so please follow us, join our email list to stay abreast of announcements and important updates and new content, and please follow us on the social media. So today we are really happy to welcome an esteemed colleague of ours, a doctor of Tibetan medicine and biocultural anthropologist, Dr. Tawni Tidwell. Dr. Tidwell shares her recent Tibetan medicine research project in collaboration with the American Tibetan Medical Association, the University of Wisconsin-Madison, University of Minnesota, and Dartmouth College. This study describes the management and treatment of COVID-19 using traditional Tibetan medicine in integrative setting in urban metropolis with various large Tibetan and Himalayan communities. For those of you who are new to our show, this is the Shangsheng Institute of America School of Tibetan Medicine. Our school was founded by the late acclaimed Tibetan scholar and spiritual teacher Chogyal Namkhai Norbu Rinpoche as part of the International Shangsheng Institute of Tibetan Cultural Studies. We offer courses on traditional Tibetan medicine all around the world and online. Our programs range from short lectures, continuing education units for healthcare providers, as well as our full-length 4-year program training of traditional Tibetan medicine. For more information, please do visit our website, tibetanmedicineschool.org. Also, we want to mention the American Tibetan Medical Association, ATMA. This organization is the national professional organization for Tibetan medicine practitioners, students, and supporters here in the United States. You can find a qualified practitioner in your local area. You can find a Tibetan medicine training program, learn more about Tibetan medicine in general. We accept professional, student, and supporting memberships, so we would love to have your collaboration. So if you're interested in learning more about Tibetan medicine and taking a step to get involved in the United States National Tibetan Medicine community, please do check out American Tibetan Medical Association.org. So I'm really happy to welcome our special guest today. Dr. Tawni Tidwell is a Tibetan medical doctor and biocultural anthropologist holding a PhD from Emory University. She is the first Westerner to have formally completed her Tibetan medical education in a Tibetan institute in Tibetan language. And having studied a little bit of Tibetan language myself, I can assure you that this is a very impressive feat indeed. Dr. Tidwell trained at Mensikong in North India and at the Sorik Loling Tibetan Medical College of Qinghai University in Eastern Tibet in a comprehensive 5-year medical training program. Dr. Tidwell's work draws from contemporary neuroscience, Buddhist epistemology, biocultural anthropology. She works to understand how Tibetan physicians embody their diagnostic practices, particularly in the treatment of cancer and metabolic disorders. And Dr. Tidwell works with the Tibetan medicine understanding of physiologic, psychologic, pharmacologic, and ritual paradigms of transformation and traditional modes of healing. Dr. Tidwell, it's wonderful to have you joining us today. Welcome to our show.
Thank you so much, Dr. Okublum.
So also, for those of you who are new to our show, please allow me to introduce our school director, head instructor, and our ongoing webinar host, Menpa Phuntsog Wangmo. Menpa Wangmo is a practitioner of traditional Tibetan medicine with over 30 years of experience in clinical practice as well as teaching. She received her advanced degree from the Lhasa University School of Traditional Medicine. Menpa Wangmo is the director of the Shangsheng School of Tibetan Medicine. She teaches Tibetan medicine all around the world, developing and implementing programs, teaching many students in the United States, Spain, Italy, Russia, and many places. Menpa Wangmo is the co-founder of the American Tibetan Medical Association, ATMA, the Tibetan Medicine National Professional Organization. Menpa Wangmo, as always, thank you for hosting our webinar. It's wonderful to see you today. And thank you all to our guests joining the show. Also, thank you to Matthew Schmuckler, our behind-the-scenes tech support. My name is Adam Okerblom. I live here and work in the San Francisco Bay Area. I'm a graduate and instructor of the Shang School and a doctor of acupuncture and oriental medicine. So, Dr. Tidwell, thank you so much for being with us today. Can you tell us a little bit, where are you now and how are things?
Great, thanks, Dr. Okerblum. I'm right now in Madison, Wisconsin, at the University of Wisconsin-Madison Center for Healthy Minds, in our remote location, as we all are in my home and clinic here. So we just got a huge snow like a few days ago. We were just talking about, maybe not as big as Massachusetts with Phuntsog, but it's really wonderful to be with all of you here today. Thank you.
And it's wonderful to have you with us. So with your work there, you maintain a clinical practice and you're involved in research projects, yeah?
Correct, yes. My clinical practice is private, and then the research is with the university and Center for Healthy Minds, which is led by Director Dr. Richard Davidson, a neuroscientist who works on contemplative practices.
Excellent, yeah. So now we haven't gotten a chance to catch up very much lately, but I have seen you here or there throughout this pandemic over the last almost year, participating in various webinars and forums. And there's been a lot of talk about the nature of COVID-19 in terms of Tibetan medicine theory and what Tibetan medicine can offer in terms of supportive care and treatment. And there's been some really great discussions so far. So I believe you have a presentation for us today about your research project working with Himalayan communities and Tibetan medicine on the COVID-19 issue. So please just share with us and please tell us everything you got.
Great, thank you so much. Well, first, I just wanted to say thank you so much for having me. It's really a pleasure to be here. Genpa Zawalma is really the Yum Temo of Tibetan medicine, the great mother of Tibetan medicine that has educated so many students all around the world, made unbelievable waves in setting a new foundation for Tibetan medicine in our global community. And it's just been really exciting to see her 1,000 arms moving in all directions at all times, and just such an honor to be able to be back here in the US and see the magic she's working, the incredible students that she's developed, and the foundation that she's created for Tibetan medicine. So first, I just want to say thank you to Genpa Zawalma for your amazing work. Remarkable, so thank you so much. And to Dr. Okerblum, thank you for hosting this and thank you for the kind invitation. I've been hearing about this webinar series for quite a while and how beautiful and professionally done it has been and touched so many lives. So thank you very much and all that you're doing every day as a physician. So, and to Matthew Schmuckler, our tech support, Dr. Schmuckler, also an amazing dancer. So without further ado, I'm just going to share my screen. Great, and do you see that? Whoops, maybe. There we go.
There we go.
Okay, wonderful.
Lovely.
Excellent. So today we'll be discussing in the broader sense the Tibetan medicine and the treatment of COVID-19 in Himalayan communities. And in this short presentation, I just want to give a sense of what has happened in Tibet in terms of the COVID-19 pandemic, the initial stages of it, and how that's framed what ATMA and Dr. Phuntsog and our team of physicians in North America have been initiating in terms of research here, the really unique opportunity we have to engage in research at this time, and particularly on COVID-19. So in some ways, I like to frame this as Tibetan medicine moving from the periphery to the center, both in Tibet, but also in the North American presence of this global health crisis and this pandemic. So this is going to be looking at just initially that outbreak context in Tibet, and then how that has framed our research. And I think in terms of design and preliminary cases, I'll go briefly, but maybe I'll leave that more for our discussion time. So the response in Tibet, so days after news hit the Tibetan plateau of the novel coronavirus outbreak in Wuhan, provincial health bureaus and central Tibet medical institutions across the region launched these protocols. And what you're seeing here is the the Tibetan Autonomous Regions Prevention and Treatment Plan. And this is for the prevention, treatment, and rehabilitation of COVID-19. And this was done in preparation for cases of infected patients to come to the provinces, come to the counties and townships. And this is launching, looking at a lot of the ancient texts that have informed this era that we call the Degenerate Era, in which these epidemics are expected to be more common and more frequent. This understanding that we have engaged in a lifestyle globally that disrupts environmental balance and patterns, that has mental dispositions that create greater greed, greater dissatisfaction with our material conditions. And that leads us to certain behaviors that then disrupt the balance to create now these new organisms, these new infectious conditions, and then bodies that also can't handle that have reduced immune systems, reduced strength. So these protocols are drawing from this very, very rich theoretical tradition, textual tradition, and historical experience coming from India, coming from Persia, coming from China as well, and that informed our medical tradition, as well as ancient Tibet and all that was endured over history. So what we see then is also formula recommendations that are drawing from these older texts and bringing in new formulations into circulation, into preparation for the outbreak that was coming onto the Tibetan plateau at the time. So senior physicians were publishing these statements across the plateau, across the central Tibet, eastern Tibet, and really instructing junior colleagues on these treatment protocols for this novel disease based on these rich textual foundations and experience of the epidemic level infectious diseases that were predicted hundreds and hundreds of years ago. And so we also saw senior physicians permeating the social media. This is a WeChat image, really drawing on public health education presentations from these root and commentarial passages from the text, some as early as the 12th century, describing hygiene practices, social distancing guidelines, protective behaviors, covering one's mouth, not partaking in potentially contaminated foods or places or exposures, and then combining these with recommendations and quotes with, of course, modern public health education style visualized graphics. This is obviously a modern drawing, but fusing that with the Buddhist framework, right, of the right mindset to have. This is a appeal to the goddess Tara, right, and Tari Tari Tereswa, you see the mantra written in there, and Amani Pamihum as well, Buddha of compassion. So how does our way of relating to each other, our way of relating to all the organisms we share this earth with, factor into the consequences of health and disease? And so these were all throughout social media, but also drawing Tibetan communities' minds back to these ancient texts, right, that remind us to expect this time period and the importance of Buddhist practice, the importance of compassion, the importance of really caring for each other, and then noting the impact of that. So we also saw professors, this is Akukunja Gensen, he's a professor at Qinghai University Tibet Medical College, giving interviews and lectures on how this disease relates to that which is in the text, how the symptomology that had become public at that point, this is again in January and February, relates to the standard nosologies or ways of categorizing disease like flu-like viruses, heat and fever conditions, and so forth. And then in these professional and private talks, say from Harvard alumnus, Dr. Younga, and Lhasa, and also Dr. Kunze Gensen got his PhD at UCLA, providing also a view of Tibetan medicine that was unique for this time period, gaining respect from the greater China national community publicly because of the capacity to describe and understand this national health crisis from also the Tibetan medical perspective. So this really opened up a possibility of a new emerging public face of Tibetan medicine, which is a stark contrast to decades earlier when we didn't have many Tibetan physicians, say, cross-trained in biomedical discourse or clinical practice, and also certainly not a national government in China open to the contributions offered by this traditional medical system. So I argue that COVID-19 has also provided this opportunity for Tibetan physicians in Tibet to come from the periphery, marginalized voices, to the center of national discourse in China. And we'll see that in just a little bit more as we move through here in our discussion later. But to showcase these significant developments of achieving a restored educational, clinical, professional spheres of the Tibetan medical field, an opportunity to show decades of repair that had to be incurred after the devastations of the Cultural Revolution, the Great Leap Forward, and that this tradition now has regenerated this from significant hard work over these last few decades, even offering concrete pharmaceutical contributions to mainland China and contributions to care and integrated medical paradigms supportive for recovering. So China classifies as Tibetan medicine as Zhongyi, traditional Chinese medicine, and it's this contemporary umbrella term encompassing all its ethnic medical traditions, the Minzu Yueyi, such that it's seen that all of these, right, are part of this umbrella family of traditional medical systems. But this policy also risks absorbing Tibetan medicine into this larger category, making it kind of invisible to the greater public. Yet Tibetan physicians have been tremendously productive in collectively transcending this limitation and skillfully navigating these restrictions and requirements, sometimes requirements that are often unspoken and merely inferred, right? Of participating in this paradigm, and a paradigm in which non-participation in this discourse will effectively amount to one's removal from existence in China, or full annihilation, so to speak. So to avoid this peril and transcend the limitations, they've built status for the tradition in this context of really engaging these major public health concerns in this global era. And COVID-19, the pandemic, has provided us with this window to see how much Tibetan medicine has redeveloped, regenerated, and been able to influence within its spheres in China at this time. So this has also then framed our experience here in North America to build foundations for its role in major public health crises. So as the expertise flooded the virtual landscape in early January from various Tibetan medical physicians across the plateau and Tibet medical institutions, they also sent physical relief. Here we see the Nakpo Gujor, the 9-compound pill that was sent with workers and large supplies large supplies of the respiratory and infectious disease medicines to affected areas in mainland China, including Wuhan. So these are the externally worn sachets, but also the various oral medicines, right? And so shipments were launched from Lhasa Mensikang, Qinghai Provincial Tibet Medical Hospital, and various prefecture, county, and private producers. And although government regulations limited acceptable relief donations to formulas that meet their national good manufacturing practice standards, so the GMP standards require that a certain certification be met within the national realm, but also provincial. So even though relief is sent to these various mainland centers, it had to be the formulas with these GMP standards. So it really shaped the landscape of what Tibetan medicine could offer at that time as well. So shipments launched from all over, but again, of these particular formulations. And this amassed in a net worth of tens of millions of renminbi. And so these biomedical institution treatments also contain formulas from Chitin, which is the biggest Tibetan pharmaceutical producer, and also has many of their licensed formulas that were sent to Wuhan, Beijing, and then their home Gansu hospitals. So though Lhasa's first reported case was not until January 25th, by February 25th, Tibetan regions had significant transmission. So you can see here, this is Dao County of Ganzhou Prefecture in Sichuan province, and it had the greatest concentration impacted in Ganzhou Prefecture in this in the early outbreak, right? And this is also primarily hit in the Eastern Dao County particularly. So donations of plateau sources then shifted from the mainland China sources then to local relief to target their Tibetan communities. And this then allowed them to really provide more of the full scope of Tibetan formulations. Shining physician Dumi Phuntsog contributed 500,000 RMB worth of one of his nationally certified formulas, Dasi Marpo. And Dasi Marpo, interestingly enough, this is really, really early on in the pandemic, right? And Dasi Marpo is a fantastic formula for fighting respiratory and brain inflammation, right? And brain infection. So at that point, our understanding of the virus didn't really look at the major consequences of systemic inflammation, particularly also that affects the nervous system. And yet these early formulations were exactly targeting that. So it's just an interesting perspective. And so this is here loading it into sent on to Wuhan. But even in areas with no reported cases, this is in Chika, this is Professor Taishu Tunduk, who was producing a lot of the Nakpo Gujur and the various Rimsung epidemic protector amulets. They were also distributed to local communities, providing virus education outreach, encouraging stringent health protection measures. We know that Tibetan communities are very tight socially, and even in a family, a house, right? We'll sleep in rooms together, we'll eat very close together. And so the importance of being very, very mindful of the practices used so that the virus doesn't rampantly move through. And Dr. Younga from Lhasa gave many, many pleas at this time for Tibetan communities all over the plateau to be very, very careful, knowing this is a great risk. And so the practices that then spread across the plateau were quite remarkable. And despite some criticism within the field, so this is a Southwest Minzu University professor, Emeritus Thupten Phuntsog, who accused Tibetan physicians of kind of exploiting this crisis, making a profit on amulets and preventative substances, claiming mantras are meaningless during epidemics, which is interesting for me because I work in a center, a research lab, where our whole work is about looking at the psychoneuroimmunological effects of Buddhist practice, of contemplative practice, the role of purpose, belief, of stability of mind, of compassion development, right? And so it's just interesting for me to see him kind of criticizing this aspect of having no evidence when it's actually a really powerful way to support the immune system. So I'm not sure whether his comments incited greater charity at the time or not, but after his comments were made, we even saw more generosity unfolding substantially throughout this time. So, and this is the Vajra armor, the Doji Gotrap. This is Akutanzen, who created many also protection, oral, physical, and area. So for the incense to create conditions for protection from the virus, teaching local communities how to use it, especially when they were distributing it. So I'm not sure how much our audience knows about the size of Tibetan medicine, but when I was in Austria at the Austrian Academy of Sciences with Dr. Stefan Plus, who is the principal investigator for this, we were able to look at across all of Tibetan regions within China, India, Nepal, Bhutan, Mongolia, the whole areas of Tibetan medicine's influence in Russia, which Genpo Zawamala is very familiar with, that the Tibetan medicine industry has grown so much over the last few decades that it's now a US $1 billion industry by 2018. So we see that the scope of this tradition, the richness, its proficiency, its rigor has really developed into this contemporary context, much more so than demonstrated earlier. And so this is in contrast to when Tibetan medicine was under heavy scrutiny, right, from the central Chinese government to appear biomedical and non-religious. And after the initial democratic reforms from 1959 to 1962, Cultural Revolution, 1966 to 76, the period following Mao Zedong's death led to this really cautious expansion and efforts in legitimization by Tibetan physicians, and that Tibetan medical institutions in many ways became stripped of much of their Buddhist or Tibetan cultural references from their medical curriculum, and also framed consciously medical content in biomedical terms to survive, right? To be able to persist during these hard times. So in the post-reform era, state funding transformed Tibetan medical institutions to these kind of partial replicas of biomedical counterparts. So for instance, we see Tibetan physicians consciously reframing disease causation explicitly and explicitly biomedical terms. And you can see this from Gen Samten's The Gyatang Sarwa, the New Dawn of Medicine, where he kind of creates these categories of nosology, which actually have been helpful today as we are more conversant with biomedical paradigms and research, but at that time was also showing and signaling that Tibetan medicine could be framed in kind of biomedical terms as well. But recent decades, we've seen this new wave also of central government support for ethnic minority medical traditions. Just a couple of years ago, we had the first policy passed in China, explicitly supporting medical traditions, traditional medical traditions, which allowed for the educational resources, clinical buildings and staffing. And they signaled that it was for combating common diseases, chronic conditions, but also epidemics. So there was this understanding that traditional medicine had a very important role to play in epidemic context. And this came from experience in SARS, the swine flu, bird flu, and also a scare with Ebola's ability to transmit possibly within China and then Tibet because of their close relationship to Africa. So Xi Jinping's advocacy for traditional culture and integration of the ancient Chinese philosophy has also created a kind of rhetorical distance to time when Mao Zedong really attacked Confucian ideas, kind of erasing them with this revolutionary fervor. And today we see this nostalgia for tradition and this eagerness for rehabilitation, for public discourse, which has really situated Tibetan medicine in actually a politically favorable climate in many ways to regenerate the tradition, to expand medical practice and scope. We see that in developments here that are related to what's happening in Tibet, in North America, but still forcing physicians to walk this fine line with religious practice, right? So by 2019, Qinghai province had procured funds to build and staff Tibetan medical facilities at every administrative level. So this was shared to me by Dr. Jotzin Chundup, who's the ethnic medicine desk director of Qinghai Provincial Health Bureau. And so access to healthcare provided by Tibetan medical institutions now outnumbers that of biomedical clinics at every administrative level across the province. So that's a really exciting development that the Tibetan Autonomous Region, a lot of Sichuan and Yunnan are also trying to emulate. So before 1950, so Tibetan medicine was virtually the only form of healthcare, right, on the Tibetan plateau. And then now we've seen this redevelopment so that it now, also, again, centrals quite prominently as the primary healthcare system in Tibet, even expanding beyond its historical reach in some ways. And it's obviously eagerly welcomed by Tibetan communities, physicians that they serve. We see also this recreation of a Tibetan cultural center. Qinghai Provincial Tibetan Medical Hospital is a massive hospital, but also is a cultural center, right? So we would have, Losar, Tibetan New Year events, great gatherings, performances, song, dance. It's a place that's welcoming for Tibetan communities, and Xining can feel like a very Chinese city in many ways. So it creates spaces, which also transfers to effective healthcare, right? Women, getting women's healthcare in a place that feels culturally safe, that feels accessible, has allowed for that to really develop in Xining. So this has been some of the exciting developments as well. And so this
Dr. Tidwell, so the Qinghai Prefecture is really kind of leading, spearheading the growth of Tibetan medicine throughout the entire area in terms of quantity of clinics and level of activity at this point?
Yeah, they have the benefit of being in a position such that they don't have the restrictions that are imposed on the Tibetan Autonomous Region, right? The Tibetan Autonomous Region has a lot of constraints within which it must work. Qinghai has a lot more flexibility. It's right on that kind of border region with mainland China. So they've been able to use that to their advantage in really powerful ways and kind of leverage that to also help and infuse access to resources in Lhasa as well. You've seen a lot of collaborations, and then allowing, I think, for the domestic context to see what does that look like, right? So yeah, they've been doing remarkable leadership in that aim as well.
Oh, that's amazing. And that's also interesting in terms of historical relevance, given that Qinghai in the Amdo region has traditionally been this kind of borderland region famous for the intersection of traditional Chinese and Tibetan culture in that area. So that's fascinating.
Absolutely. And I think that what we see is that before, Dr. Sienna Craig has talked about, there was kind of this crisis of confidence. And now we see Tibetan physicians really gaining confidence, feeling they're competent alongside their biomedical peers, right? And segueing into a place where Tibetan medical education and clinical bodies are really working in tandem or full integration with their biomedical colleagues through partnership, cross-training. So I think it's a really exciting time also. So yeah, as well. So I like to think about this as quote, a rehabilitation of confidence, that we're seeing the ability for Tibetan medicine's unique contributions to really come in a new time period. And on this side, the neuroscience research that has generated insights on the health benefits practices of Tibetan Buddhist expert meditators and contemplative practice, I think has also provided and generated a pride and a confidence to be able to talk about the Buddhist institutions. You know, His Holiness has done amazing work with the collaborations with scientists, but also in Tibet, we see this transfer to where they feel there's a space for talking about contemplative practice on a science level, which gives them access to also preserving tradition. And in a medical setting, actually providing that kind of guidance. And you see Chinese patients actually receiving that kind of guidance as well as Kat Hardy's work looking at the China's Buddhist revival in Larungar, and a lot of mainland Chinese gaining and seeking Tibetan Buddhist teachers, right, for lamas. So we see this relating also to the Tibetan medical context as well.
Yes, I remember when I was in Amdo, and then we were visiting some sacred places, and it was very inspiring. It was very good to see many Chinese tourists traveling sometimes from far away to come to monasteries, to come to different places. And it's really good to see that rekindling of interest. I think a lot of people in China were very thirsty for this type of knowledge, and it's wonderful to have that available.
Absolutely, absolutely. I mean, all the way from Harbin, right, way over near North Korea's border, coming out to Sichuan and Yunnan and into Qinghai. It's been really quite remarkable. So yeah, great. So I'll just kind of move through here real quick. And then we can get to the North American study. But I just wanted to mention also that as news of containment in Wuhan spread, Qinghai also had started to receive cases, right? And they were accepted for post-recovery care at their hospital. They also had developed their protocols. What we see here is the Dao County team, also with Ganzi prefectures, also Derge County coming in as well. And so what they were talking about is, as dozens of cases started emerging, that they were being treated successfully, again, with an integrated biomedical Tibetan medical approach because of the protocols nationally installed, but really being seen as these kind of cultural heroes, right? Of bringing back a pride, a confidence in the capacity of Tibetan medicine to be able to participate and really enact important benefits. So amid these reports, then Zhong Nanshan, which is China's chief coronavirus expert, announced the National COVID-19 Research Committee's interest in Tibetan medical approaches for mild cases, and talked about some preliminary efficacy evidence and potential insights from, of course, a history in high altitude hypoxic environments, but announced then a research collaboration with Chitin, this Tibetan pharmaceutical company, a 40-subject clinical trial in Wuhan. 3 of Chitin's nationally approved formulas were then used in there. And then we saw reports coming out of new ways of understanding how Tibetan therapies could be used in biomedical hospitals as well to reduce mortalities. And that local plateau research institutions were starting to receive national funds for expanding their studies, expanding their research. So Tibetan physicians we see there's this skillful navigation of the historical conditions, contemporary circumstances, regulating participation, but then navigating those in really, really productive ways to create this kind of awakening of a tradition in an increasingly global integrated health landscape, right? And so we see that as COVID cases came in, you see this on late January was the first cases, and they were actually pretty similar in their breakup. Primarily male was the greater percentage. We also saw more just in adult populations, less in the elderly, but no deaths. And we saw that many of the comorbidities that came in, we saw how Tibetan medicine kind of maneuvered its treatments around in that way, and how also the various medicines that were brought in were even a lot of the precious pills, a lot of our classic formulas that were used from directed for this kind of an epidemic context, our decoctions, the Nobaduntang, the Chultang, and then them coming on to various productions to be able to talk about their lessons learned and approaches for future. So this is just some of those, and this was shared by Dr. Nya Gyaltsen from Ganzi Prefecture during oops, it looks like sorry about that. I didn't mean to go all the way into that. Okay, so now coming to, so this really set this context for what Genpo Wamala and a lot of our participating physicians here in the US recognize as an important time, because in Tibet, because of the context, the national context where you have to use biomedical treatments alongside Tibetan medical treatments, none of the patients received only Tibetan medicine. And so they appealed to us and said, you guys in North America have an opportunity, because lo and behold, so many of our communities that are heavily hit by the virus are Tibetan, because say in Queens, New York, right, they're an epicenter of the virus. And yet we don't, unlike Asia, right? In Asia, many who got infected went straight into the hospital, got antibiotics, got, the full workup of steroids and everything. And so our patients who were mild and medium severity cases didn't get access, didn't go into the hospital, had to get treated at home. And many of them relied on Tibetan medicine. So we started getting dozens and dozens of notifications of cases that had been treated with Tibetan medicine. Genpo Wamala started seeing patients. We started seeing patients here in Madison. And of course, it was changing things, right? Because you can't see the patient personally, right? So send your picture of a tongue and your urine, right? Trying to triangulate a whole new context of Tibetan medical diagnostics in a pandemic. And so this provided a really exciting time for us to say, well, why don't we track these? Why don't we see what is the possibility of the outcomes? So, and that we have this different context, right? So this is Ganyambam Gala, he's one of our colleagues. And so he sees patients in a small clinic here in Madison, but also in a colleague's clinic in Chicago. And so we aren't in the same context where we're in hospitals and regulated by the hospital context, right? We have our home clinics, we have our private clinics, and we can kind of maneuver through policies, through health freedom acts that are different from state to state, or some people like Dr. Okupulum yourself, that is also trained in acupuncture and Chinese medicine, have a different way to operate in this policy context. So we held some meetings to just try and draw this attention from those in the Amti community that wanted to participate. So we got 20 interested Tibetan physicians who had been seeing COVID cases that wanted to participate in the research. We identified about 200 cases that we had just heard about before we started kind of bringing in the data. These were, New York, Toronto, Minneapolis, DC, San Diego, San Francisco, here in Madison, across Massachusetts, and then in Chicago. And so ATMA, the American Tibet Medical Association, really led the charge to initiate this. And so because of the way research is done in North America, without a university affiliation, it's really hard to do research, right? In order to get the institutional review board to look at your protocol, to make sure you're protecting participants, to make sure you're abiding by HIPAA rules, to make sure that the grant money is dispersed according to proper protocols of research, right? So we really had to create university alliances. So Dr. Sienna Craig at Dartmouth was the first to say, hey, I'm happy to start moving that along for you. I have this other project, which is Himalayan New Yorkers telling their stories of their experience of COVID, right? Being the epicenter of the epicenter. And she said, you know, so many of them are the ones that are being treated by Amchi Tibetan physicians. Why don't we link up? And so she kind of opened that door for us. And then I approached our team here at University of Wisconsin-Madison, and they said, we'd support you. We had no money, right? We're just working on, you know, voluntary, usually with a grant, you need, you know, $20,000 isn't even a very small amount. Or isn't even a sizable amount to pay research assistants and statisticians, right? So we had the International Association for the Study of Traditional Asian Medicine, IASTM, said that they would offer $2,000. Arizona Friends of Tibet heard about it. They said they'll offer $2,000. And now we just had the Foundation for Psychocultural Research, Cultural Mind and Brain Network that said they'll offer $15,000 to really help support us. So it's been really exciting with student volunteers from UT Austin, UC Davis, UW-Madison. I mean, it's just, I feel like it's the heart that's motivating this research, right? The belief in what's possible and the desire to see this come through. So part of what we did, so we called it the North American COVID-19 Tibetan Medicine Observational Study. In all research, if you have a good acronym, it goes a long way. So we called it NACMOS. And also teaching our Tibetan physician community how do you do research, right? So many said, well, why don't we do a randomized control trial? And we said, well, we don't even have preliminary data, right? And so in order, like the research that has been done on Tibetan medicine has been fantastic, but pretty limited. So I had the opportunity to work with Dr. Susan Bauer-Wu, who's the president of Mind and Life Institute. And with Mensi Kong in India, we did a retrospective case analysis similar to what we're doing here with COVID on cancer. Published that in 2014. Amchi Lobsang Tundup and Dr. Cynthia Husted looked at multiple sclerosis. Dr. Rinchen Tundup, atrophic gastritis. Mensi Kong and Dr. Tindanamdo looking at diabetes. And then right now at the Center for Health and Minds, right now we're looking at asthma and its relationship to neuroinflammation. And then COVID, right? But we haven't had a lot of ability to show our formulas are extremely complex and they're extremely nuanced. Right? Our formulas sometimes have 140 ingredients. And to be able to prove what is the activity in those formulas to lay the foundations, right? So Amchi Yeshidundan early in the late 1990s worked with UCSF on the breast cancer study, and they were never able to publish that study because for a variety of reasons, but the FDA only could certify 7 of over 50 formulas that they wanted to use, right? And so even with only 7 formulas, he was able to, for 4 patients to show statistically significant at stage 4 breast cancer, halting, not remission, but halting of the progression of the metastases that these women have been experiencing. So very impressive results, but because it hasn't been published, it's not on the radar, we can't use it as foundations for our literature to then gain grants, to gain support for this kind of research. So that's part of what we've been looking at. So that's why we went with this retrospective case series studies to say, okay, first we need to show in the wild, as Amchi are producing their results, right? How can we track them? So we created a data template and to fill out what are the initial symptoms that patients come in. When was their positive test for the virus? What was the test? Was it PCR? Did they get an antibodies test kind of after the fact, right? And then what formulas were used over each course of treatment? When did the symptoms start actually disappearing? And do they have any blood work or urine work or imaging data that we can also link? So we have biomarkers to then track and show some of these case studies, right? And then what was the final outcomes? If it was a suspected case, ask these patients to go ahead and follow up for an antibody case so we can confirm it was a confirmed COVID case. So this is part of what we've been looking at. And some of the inspiration of this, I think, comes from Amchi Lobsang Tundup and Dr. Cynthia Husted work, where they were able to show that the thermodynamics of the myelin, right? The changing of the myelin, how it actually creates velocity through the neural signal, right? could be classified according to the Nyeba Sum, Lungti Vegan Sum, right? And that you could understand and predict then who was more likely to develop multiple sclerosis, an aggressive form of multiple sclerosis. How does that actually change treatment, right? And could we then think about, are there constitutional predictions for COVID-19 pathogenesis? And then what are some of the long-term implications? Like what's at stake here? Well, we've seen long haulers having tremendous effects now because of chronic inflammation and these long-term health concerns, right? That we have the opportunity to intervene and stop this. So far, we have seen that our cases are not showing long hauler effects, and we still have to go back to our patients, right? So in terms of when we first started, part of what we needed to look at is how do we classify mild, moderate, and severe disease, right? And so early on, when the WHO was kind of figuring out, they were just classifying severe disease, saying, okay, you have clinical signs of pneumonia, a respiratory rate greater than 30 breaths per minute, severe respiratory distress, and less than 90% of oxygen saturation. Well, for us, that's not helpful because we had mild and moderate cases that weren't going into the ICU, right, that were staying home. So finally, the NHS started having a more nuanced way of understanding disease. And what we saw is that a lot of our cases are mild, that they have signs and symptoms of COVID. We have some asymptomatic cases, but they don't tend to have presentations on chest imaging or evidence of lower respiratory disease, although we do have some cases of this, right? And then how can we then look at what data do we compare to? So in North America, mild and medium severity cases are kind of this like, it's not even on the radar, right? The data comes from severe cases. So in order to have a baseline to compare our cases, we needed cases to compare what is the normal progression of disease. So, and then what happens in the home, right? So we've been kind of reaching out to different data sets that we're looking at, and what is the actual conventional guidance? Well, we see, rest, healthy diet, limit intake of sugar, high processed foods, a balanced approach to one's contents of the diet, hydration, over-the-counter medicines, right, for fever reducing. But we don't have the ability to actually track patient by patient what these mild and medium severity baseline cases are actually partaking in their daily care. So we're just assuming that this is the approach that they're taking, right? And then we also have this introduction now of monoclonal antibodies by some who are mild and medium severity cases that have the high risk to progress to severe COVID, right? But for us, we have a really complex treatment approach, right? We have constitutionally informed diet and lifestyle guidance. We have the various stages of the fevers, the unripened fever, coming to ripen, proliferating, even empty fever. And then we modify the dietary and lifestyle modifications according to those stages, active management of fear and anxiety, rage, loneliness, right? And really encouraging them to pay attention to their body. And then this huge pharmacopoeia of medicines, right? Our decoctions, Kyunga, a lot of our anti-inflammatory, anti-infection medicines, and then a whole host of formulas applied depending on the pathogenesis of each case specific, right? So it's been exciting to see that as we're kind of looking through the data, that we're able to see now we have a data set, an ambulatory clinic in Massachusetts that looked at, okay, on average, most mild and medium severity cases move through on a natural progression to recovery in 2 weeks. For us, we're seeing actually 10-day recovery periods. And this is in general, on average for our cases. Now, those with comorbidities, particularly heart, lung, and diabetic patients, we do see a longer time. We also see a lot of these other comorbidities providing a more complex presentation of the disease, but we've had no hospitalizations thus far, so preventing also. Of course, we can't prove that, but we can at least say of the sample that we have, none have been hospitalized, none have died, no cognitive affective symptoms, no hallucinations. Again, this is more for those severe cases that's been reported in the conventional circumstance. But at least this is what we're able to look at and say, our baseline data is dependent on these small data set samples, say for this ambulatory clinic in Massachusetts, but we can say confidently that we're seeing faster recovery periods and thus far not the persistent long hauler effects that we have seen more common across the conventional treatments. So I'm going to stop there and open it up.
Wow, thank you so much, Dr. Tawni. That is amazing research. What an inspiring study, and wow, that is really great. Thank you for all of that.
Thank you. Well, it's been so exciting. I think one of the most exciting parts for me is at least seeing our our Tibetan physicians, our Menpas in North America doing amazing work, right? And the opportunity for us to really bring everyone together and to say, let's witness what's happening and let's take a moment to see what is the contribution of Tibetan medicine at this time, case by case, and tell those stories and look at those cases and understand it from a professional perspective. What have we learned from this? But also show up. Traditional medicine and Chinese medicine, I'm sure you've seen this, has received a lot of criticism among the COVID pandemic, especially in North America. And Ayurveda hasn't even really been part of the conversation in many ways. And so to be able to also, as a community of traditional medical practitioners, to say, we have tremendous value to give and remind people about some of the most basic aspects of self-care, and then herbal traditions that have incredible wisdom, right? Incredible value, and the role of the mind, right? The role of the mind in our bodies being strong. So it's just been exciting.
I mean, when we talk about the catch term holistic care and going everything from diet and lifestyle and, mental, emotional, mind training, all the way through the most advanced of pharmacological interventions with multiple formulas, specifically administered over different stages of a pathogenesis of the disease. Everything from the most daily, everyday, everything from the boiled water all the way to the most complex treatments. So this is an incredible holistic spectrum of treatment. And somehow you have really encapsulated that very well in this study as you presented.
Oh, well, we have an amazing team. So, so excited.
Yeah, it's really inspiring to see this kind of emphasis and this recognition of Tibetan medicine's potential for treating these type of pandemic diseases. As we see the exact same thing in the Chinese medicine and Tibetan medicine. These ancient medical traditions are steeped in a wealth of information about treating epidemic diseases and contagious diseases, because this was such an important part of life throughout the centuries in traditional cultures, and obviously still is today. So seeing this recognition and seeing it going back to the classical text, the ancient primary sources, like you mentioned, that's another thing I loved seeing about your presentation, Dr. Tidwell, was the recognition of these classical primary sources as being the root and having something concrete to offer in this conversation about treatment of these kind of diseases. So it's really inspiring. Thank you so much.
Thank you. I also have to acknowledge, I didn't mention Dr. Timothy Namdula too. He's been an amazing partner in this as well. And he was the former clinical research director of Mensikang in India, came back to the US, got his PhD, also at Emory, and now is at University of Minnesota as a postdoc. So he has, in partnership, we've been able to see how much his lessons of leading research in India, like I had no idea about this really, but the kind of techniques you have to use to like get people to respond, right? And how, and especially our AMSI, they do their thing, right? In some ways they're like, we're doing our clinical stuff, we don't need to participate. And so he's been so amazing at like also making these personal contacts and getting them inspired to participate, and using his wealth of expertise and experience to manifest that. So I can't emphasize enough what an incredible team we've had. Ganyandun Kasama also has been beating the bushes, getting everyone out, and just throughout such an incredible job. So I just really, so thank you. And Gimpuzu Mamala for leading the whole charge. So.
Well, it's a very inspiring project and a fantastic team. And I'm so joyful to hear that you had the collaboration of the universities and you were able to get some resources. So congratulations. I'm really, both of you, I'm really delighted to hear about this study. So how about we continue on now and talk with our school director and host Menpa Wangmo for a little bit. And then we have plenty of time, so we will circle back. If anything else you think of, more ideas, we'll talk it in a little while some more, okay? And feel free to jump in at any time too if in the discussion. So Menpa Wangmo, thank you so much for being with us. How are you today?
Thank you. Yeah, I'm doing well. Thank you.
So may I ask you a few questions about both your participation in this inspiring research and then also just in the Tibetan medicine context of COVID-19 in general?
Thank you. Yeah. The first I want to say really is listening the Tawnilas and then Adam. It's for me, it's I had I sort of like new idea or new sort of like feelings. So now is a good part. What I see is another one generation, another one sort of like a different language people, or maybe we can say maybe it's like a different ethnicity. Taking care of the Tibetan medicine in your hand, going ahead. So this is really such wonderful things to see. So I want to say thank you, Tonila, Adamla, and then Matthew. So all those people who is really taking care of the Tibetan medicine in your hand, holding in your hand, we need these kind of people. So this is really, I see it's just such a wonderful things. I want to say thank you. Because it's not the Tibetan medicine, something is it belongs to Tibetans or Tibet or this or that, not is this or this. Because Tibetan medicine has the benefit to all the humanity. This is the value, not the Tibetan medicine, something is belongs to Tibet or something losing the Tibetan medicine, then something affects to the Tibetans, not only in that issue. Yes, of course, Tibetan medicine, something happened, lose. First thing who affects to the Tibetan people, that's true. But its main point is to affect to whole humanities, whole world. So this is really, I want to say thank you. So another one generation, another one group taking in your hand, you know. And then another one, yes, Adam, last your question is, as we know, since last January, we are sort of like kept hearing this pandemic is somewhere in the east, starting somewhere up there. At that time also, so most of like Asian region is affected at that time. And then all the thumbnail I shown to you. And then by the March, then then February, I was in Tenerife in Spain. And then the virus arrived there, sort of like. And then in March, I left from Tenerife to come back to the United States. And then, yeah, soon after that, I got here, then we locked down. So then sort of like arrived here. So this is sort of like a pandemic, sort of like, you know, like the spreading in the Tibetan medicine we call is a yam. Yam means is a sort of like a yam is like literally yam is like the air element. Yam is like that the disease goes through the air element, spreading to the regions. So this kind of sort of like the Nyayam then arrived everywhere. Then the beginning, I had an idea, I mean, the experience working this kind of like one pandemic disease. I mean, one contagious disease, not really pandemic, in my hometown in Tibet, in Eastern Tibet. At that time, the disease hit to where I was. I have an experience working with the people in the remote area. So at that time in the early 1990s, so as we are pretty remote region, so I make the herbs for them and then I send it to the nomadic peoples. And then people who live in the same region, I cook the medicines into like decoctions, and then I put it into the jar and then deliver to door by door. So I have this kind of one experience. So when I was in the Tenerife studied, I tried to make the same sort of like decoctions, put into the temples where the gathering people area in the kitchen, try to give to the people. And then after that I came here, then we locked down. So then I tried to make the same herb. Now it doesn't work with the liquid because lockdown, we cannot send the liquid around. Thank God the post office is really, I want to say thank them. So they're working. So we able to deliver the herbs here, there. So I send herbs like 1,000 people. But the meantime, also people calling, and then, people calling, and then they're having sort of like troubles. And then what can we do? Tibetan medicine generally for us important to check your pulse, look at urines, tongues, eyes, so on and so forth. But everything is a lockdown. We cannot access those things. And then to just make a comfort and then do our best things. We started doing through the Zoom, through the internet. And then as Tonila explained, it's all together like a whole Tibetan medicine doctors who live in the North America. I think we worked like a couple of hundred peoples. And then special people who live in the major cities in New York, Canada. So those kind of doctors, they worked tirelessly. And then, so each person, we got a very good response through this working. And then we get an idea why we try to reach little bigger audience. Because our main goal is we able to reach bigger audience, larger community to benefit to all sentient beings. Because we are living up to now is we got a lot of from the society, and then we want to give back things to the society through what we can do through our capacity. And then also keep hearing every day in the news, like those numbers really is making scaring. Sometimes I think I'm making mistake in my numbers. But when I go back, it's not a mistake in the numbers. It is CDC, they announcing every minute when you go to the news, the numbers are rising. It's amazingly. When I'm hearing all those numbers every day, is sort of like it got like the disease, like really this is just reading those numbers is scaring. So then the number reading doesn't help. So need to do something. So then we come up, Tibetan medicine, all the practitioners, we try to get together and we see what we can do to our people. Since we are living in North America people is our people. We are belongs to that land. We belongs to this culture. We belongs to this society. This is our people. How we can do, what we can do. Tibetan, we have in proverbs. If you drink the water of that land and you belongs to that land, you need to do something, feed back to the water, to that region, to that country, to that land, or whatever. So like myself, I've been in this country 22 years, 20 years almost. So need to give back to our land, our people. So this kind of reason we come up, we try to get all the Tibetan medicine doctors, what can we do? Everyone wants to help. But then we need something concrete things to show the people, to convince them. Not really convinced, but it's to trust them. So then we started the research through the ATMA. So we're in charge of the ATMA, taking this responsibility of this. But then they mainly Tenzin Namdula and the Tonila take over all this in charge of this research. So today I want to say really on behalf of the ATMA, I want to say thank you, really, you took this in your hand and then you worked and then we're going to get a result. So which is a wonderful things. So this is how I involved with this project and I'm still following this project. I mean, not I'm personally, but it's ATMA. So this is sort of like how I involved. Today, I want to say one thing to the listeners or the followers. The Tony gave such a great overview of the pandemic, started up to now, what are we doing, how they're doing. So it's such a good sort of like conclusion of that. So when we're looking sort of like at the pandemic or whatever this contagious disease, to get that disease could be there is many reasons. So we talked many times since March, no, since April. Also, we Shangshun School of the Tibetan Medicine, we try to have the webinars. We try to introduce to the people sort of like a knowledge of the Tibetan medicine and then simple like home remedy, how they can help. So this kind of, we talked a lot of COVID-19 since the April of this year up to now. But main thing, what we say, also CDC, they say same thing, no? If you have strong health, if you don't have like a additional disease, like or like health history, and then there is less chance you get the virus. Even you get the virus, there is a big chance you may overcome. So the pandemic is already there. So then now there's not so much things to talk. But now what we need to do is we try to not get the virus to us. So which we call it prevent the virus. Prevent also, we can prevent long-term prevent, medium-term prevent, and also short-term prevent. Long-term prevent, like a virus, not COVID-19, but in general virus, is we try to take good care of our environment and try to be kind to each other. So when I'm talking sort of like environment, I think environment could be two environments. One, outer environment, what we can see, where we live, what are we breathing, what are we drinking, what are we eating. All those is environment. All our healthy food coming from the environment, from the land. All the important things, what we drink is from the land. All the important what we're breathing is from the land, from the outer nature. So this is one sort of like environment. Inside that environment, included as human beings, there's many other sentient beings. We all need this land. We all need to live together into this land. So respect to the other sentient beings, respect as human between us, and together try to keep this land well. So this is one thing I see. Another environment is our body. Our body also could present as like a universal, like a mandala. We can understand this, our body is like the land where our consciousness is living, where the hosting our consciousness, where hosting our life. Inside this, our body, we think I am a human being, I am breathing this or that, but there are millions of beings living into that body. Same like Western medicine, I guess they explained also Tibetan medicine, we call symbol. like microorganisms, infinite microorganisms living in our body. So all those microorganisms included, like the my consciousness, we all need this body. We all need this body to stay with that body. So also we need to respect each other. So same time when we're taking care of the outer nature, also we need to take care of our inner nature. Our inner nature also not too polluted. Sometimes we complain the outer pollution, too many cars, too many gas, too many factories, too many this, too many that. Now is polluted. That's true, it is polluted. Sometimes when you go to a big city, and then sometimes the whole sky is dark. Happened. But the more important, we don't see how we are polluted our mind. Our mind is polluted by the jealousy, by the hatred, by the angers, by the attachment. Why those comes? Because we are ignorant. So for that reason, I want to also ask people to keep good, clean your own self, and then together you try to take care of this, our land. Each of us, our mind is pure, clean. For sure, we will not make such a big mistake things, how we managing today of our nature, If we have a clean our mind, for sure we are much kinder to the other sentient beings. If we have a good mind clean, for sure we respect better to the human, to other humans. So this is one important. Another one, in the Tibetan medicine, we say is like the po shingsan dabe medu so. In the Tibetan medicine we're talking is important. There's one substance called dandang, like pure essence. Western medicine talking, there is important substance which is called the immunity or immune system. If we have this good, then there is likely will prevent from the contagious disease or maybe any other disease, which means is the body have a good sort of like wearing sort of like arms, like the protecting. How we get that one? We get that one is if we have a good digestive heat, good metabolic heat, now we will get that strong. So for that reason, to prevent that the metabolic heat is very important. To protect them, to prevent not losing. So try to drink the most simple, inexpensive is hot water. So please try to drink more boiled hot water. So this is one thing. Plus, if you want it, also you can drink cardamom tea at the morning. So cardamom is one of the very important spicy or medicines for kidney and digestive heat. So you try to drink 3 to 5 pieces of cardamom. You crush them, boiled, and drink morning. So this is also very simple, inexpensive, but it's a huge benefit. So this is one I want to say. The second thing what I want to say, same thing. Once we protected well the metabolic heat, that will abstract all the body cells from the food is better, clean. That will help us to have the good, strong body. But in the meantime, if we have like too many like stress, anxieties, depressions, and that can cause to losing the immune system or immunity, or the Tibetan we call dandang. So that can cause to losing the dung. What I'm saying is losing dung is not only that the metabolic heat, not only the food, but also if you have certain emotion problem, same way that can cause lose. As I said before, your land is very polluted. It still is, we're not going to get its good crop. Same that way also, once we able to cultivate more kind, loving, gentle, if we became more kind or compassionate, our mind's more relaxed. That is very logical. If we have like more jealousy, more anger, our body became like tight. Always sort of like, like we are worried about someone going to attacking us. Those are, we became very rigid. Even I have time to relax, but my body is relaxing, but my mind is not relaxing. Once we have like a compassion kind things, we try to develop. Once we get a minimum develop, that help us to relax our mind. Once the mind is relaxed, then physical body is and automatically will relax. Some people work very sort of like strong work and then many hours, but the mind is so relaxed because they have a lifestyle, because they understand what is the main point, what's really value of the human. So for that reason, my main things, what I'm going to say is please take good care of our outer nature, and please take good care of our inner nature, which is the body self. So that's I want to say. And then if you need more information, please go back to listen our webinars so you can find it there. That's I want to say. Thank you.
Thank you, Menpa Wangmo. Thank you so much. Well, that basically covers everything very well. Thank you so much for your words. Are truly inspiring. I
Thank you.
personally love to listen to your teaching these
Thank
things. Also, I want to give a little plug right now while we're on the topic of Menpa Wangmo's incredible teachings. Just to say, our audience viewing, Menpa Wangmo is going to be offering some more courses, short weekend courses, going a little deeper into some of this kind of content, a little bit more into specific topics. So over the next year, please do keep in touch with us to learn about Menpa Wangmo's upcoming short public courses. I really do highly recommend that. Okay. Menpa Wangmo, may I ask you a couple more specific questions about some of the topics we talked about today?
Yes, please.
Okay. So one thing you mentioned earlier was this concept of the Tibetan medicine view of what we would in modern times call the immune system or immunity, and kind of the general way that our health can protect us from disease and preserve our health and vitality. Now, in modern biomedical medicine, the topic of immunology, of the immune system, is very complex. Many different aspects all around our body, kind of just like, well, it seems like everything's playing a role potentially. And every year it seems like they discover a new piece of the puzzle, like, oh, and now your immune system is also pertinent to this thing in your lungs, or this thing over here, or it's a kind of a big constellation. Fascinating stuff. But in Tibetan medicine, we have a kind of very fundamental theory that goes right to literally to the core center of our body, and is related in a very simple way with the kind of basic health of our whole body. And that is what you mentioned, this idea of the dang, what we call the essence. So can you please just tell us a little bit more about this dang essence and what it means for our health, just however you want to share?
Mm-hmm. Thank you. Okay, so the dang is that one of the most pure essence which productions from our food. So to get into the dang takes approximately 1 week. An example, today's my breakfast, and then next Friday around 12, then it turns into the Dang. So between there is 7 bodily constituents, sort of like 7 like body tissues, like the blood, muscle, bones, fat, bone marrow, reproductive fluid. So this kind of way there goes down. And then once we get down to the reproductive fluid and the pure from the reproductive fluid transform into the Dang, is a very tiny one drops and then goes to the heart chakra, stays on to the sort of like the located in the heart chakra area. So this is sort of like a Dang. And then the Tibetan medicine, we do not talk so much about the Dang. But this, that the words of the Dang means is like the radiance. So the radiance means is sort of like a light to protect, to make it visible, to make into the life, you know. So we need light, no? In the dark comes, then we need a light. Why we need light? Because without a light we can't see. So this our Ndang is not only protecting, but also to show the path, which means is like the Ndang is like connected to the whole entire our life, to producing, to protect, to prevent. So whole part is involved. So that is sort of like the Ndang. So if we have good Ndang, then we have is good complexions, good determined, good self-confident, and also healthy bodies, healthy voice, strong voice. So all those kind of things comes from this, that healthy Ndang. And then also the Ndang, many other parts explained mostly through the teachings. So this is basically is the Ndang.
Wow, not only the power of protection, but also the light showing the path. That is beautiful. Thank you, Menpa Wangmo.
Yeah.
So Menpa Wangmo, earlier in Dr. Tawni's presentation, she mentioned some specific herbal formulas. And one thing that came up several times was this external formula that can be worn on the body called the Nakpo Gujur. And so this is something traditional in Tibetan medicine that goes back to the Gyuji, the classical texts. And so can you please tell us a little bit about the traditional Tibetan medicine view about wearing the protection, the pills and different things, using herbs and other substances, protecting against the epidemic diseases? Can you tell us a little bit about those kind of things?
Mm-hmm. Okay. So yes, in generally Tibetan culture is we wear sort of like the protection cord. So this is like the one in general Tibetan culture was. Because it's we believe that the protection cord is made by a teacher or master who you believe, who you trust. Like in our case is sort of like His Holiness. So these kind of things we wear because is we trust, we believe. Why? Because he is such a great master. For us, is he is sort of like the life Buddha. So this kind of reason we wear because that helping us. But this that the herbal formula comes to the wearing on the body, there is three main reasons helps. One is that the power of the herbs has a certain power to antivirus. So this is one reason we wear. Second, we wear that how they help to antivirus, how they're helping to prevent from the virus. Also, not only their power, but also their smells. So these two reasons we wear that because is that the smell aspect is the disease also like it comes through the air element, as we said before. So I think now also CDC said is like the airborne virus, no? Sort of like this kind of virus is it comes through like living on the sky somewhere up there, even we do not know where it is. But so this kind of like the disease on the air, circulating through the air. So then this that the smell of that the formula has a power to rejecting, preventing. So this is one reason we wear that. Another reason we wear this one is when we formulating this one, very strong, like a 9 ingredients. We call the nakpo. Nakpo means is a strong. 9 strong ingredients, plus has a strong smell. On top of that, we do a ritual practice. So that the practice, we chanting mantras, we do the practice. Through that practice, also power of the mantras, power of the practice, power of the deity also helps to prevent, because is those kind of like a virus disease is also predominated by the provocations, we say that, which means is we aggravated to someone, there's someone revenging or showing unhappiness things. So this sort of like 3 reasons, then we wear on the neck, and then that really gets like that the benefits. So I will show you also one of the my sort of like the Napugujor, which Tonila showed you. So we make like this, and then wear, and then what you need to do every morning, you need to sort of like smell. So you wear on the neck, then strong smell. So you need to do that. But if you have this kind of one from somewhere, and then if you are senior age or if you are pregnant woman or something, you need to be careful. So this also you need to go under the doctor's like recommendations. So not something is you can buy and then you can wear without any notice, no, but is important. Yes, that Vanilla is going to show another one. Yes, that's one. Yes. So the Napu Gujur, there are also many different things. Some of them Napu Gujur also, there's certain herb is detoxified, even is like the strong medications, but it detoxified, and then you can use also small portion internally also. They also existed. But what we have now, the wearing on the neck is just made like to wear on the necks. Yeah. I had a couple of them made when we had the last like the contagious disease like SARS at that time, and then I'm using this time perfectly, sort of like working. I mean, who I gave is they didn't get the disease, so I guess it's working. So
Thank you, Genla. Yes. Okay.
yeah,
Strong, very strong herbs and strong mantras.
yeah,
Excellent.
yeah.
All righty.
Yeah,
Well,
in general, Tibetan medicine, when we making the formula is that the practice is one part of the to empower the medicines, not only Napu Gujo case, but is that the most Tibetan herb, I mean, all of them is they are like a practice with that.
yes. Yeah, very important part. Well, thank you so much, Menpa Wangmo. And now that we're getting ready to wrap up, Dr. Tidwell, any closing thoughts or anything else that you wanted to share with our audience we maybe didn't quite cover yet?
No, it was just such a wonderful opportunity to be here. Thank you so much. And thank you to Genpa Dzomala for beautiful teaching, and all our audience for listening, and Dr. Okapum for your wonderful hosting. So thank you so much.
Thank you so much for joining us, Menpa, Dr. Tidwell. It's a really great presentation and very inspiring study. So please keep up the good work and keep us informed, okay?
Thank you so much.
Menpa Wangmola, would you like to say anything in closing before we finish for today?
Not so much really now. I just want to say thank you, Tonila. Thank you, Adamla Matthew. So audience, people who listen, please take good care of yourself. Since the pandemic is still active, please don't travel so much. And then now holiday season, for sure, many people feel sort of like need to travel. So if we are healthy, if we have long life, the holiday we can do anytime. Once we're healthy, every day is a holiday. When we are not healthy, then it's even a holiday time comes is not important. So holiday is like a inside holiday, you know, not outside. So please try don't travel so much and then taking good care of. And then to, if you want more information, to listen the other our webinars, because a lot of webinars, there's a lot of great speakers, teachers came, and then they give such a good informations about the COVID-19, how to deal with that. So please listen these kind of things. And then I want to say thank you, and then see you next after 2 weeks. Thank you.
Thank you again, Phuntsog Wangmo, and thank you all so much to our viewers. We thank you so much for tuning in, and please keep in touch with us on social media. You can check out, as Menpa Wangmo said, you can see our previous videos on our website, TibetanMedicineSchool.org, or also on YouTube, Shangshung School of Tibetan Medicine. And please do join our email list. I'm Adam Okerblom. It's been a real pleasure. Thank you so much, Dr. Tidwell, Menpa Wangmo, and we will see everybody next time. Happy holidays. Please stay safe. Thank you so much.
Thank you.
Thank you so much.